KerraFoam Gentle Border from Crawford Healthcare is a silicone bordered foam dressing. It has a silicone border along with a silicone wound contact layer. It's designed for both wounds and protection and comes in a variety of shapes and sizes. Now let's talk about some features and benefits. Most foam dressings use a traditional open cell foam. Open cell foams are not much different than a foam used in sponges. When water enters the foam, it can easily be forced out by squeezing or applying pressure to it. KerraFoam uses a technology specifically designed to manage fluid. When exudate enters the dressing, it becomes locked into its core, preventing the fluid from squeezing out and causing peri-wound maceration. KerraFoam's inner core has three main components that make it different from other foams. First, it contains a unique wicking layer that pulls exudate into the dressing and away from the skin. It then disperses exudate throughout the entire dressing, allowing it to use the whole dressing instead of just the area over the wound. Second, the absorbent core and foam pad locks exudate into the core even when under pressure, such as compression or when a patient rolls over on the dressing. And finally, a soft inner pouch that allows the layers of the dressing to move freely, reducing shear forces that can damage at-risk skin. When these unique inner layers are paired with the outer polyurethane film and the gentle silicone adhesive, KerraFoam becomes a dressing that is excellent for both wounds and protection. When KerraFoam was tested against other foams, it showed superior results for tests that are known to matter in a clinical setting. This first graph shows the amount of fluid that KerraFoam absorbs compared to other foams. More importantly, how much fluid it retains when a weight is applied. This retention of fluid means when your patient puts pressure on their dressing, the exudate and harmful components such as bacteria and MMPs will not be forced back into the wound or onto the healthy peri-wound tissue. The next graph shows how KerraFoam compares to other foam dressings in relation to moisture balance. While some dressings have a higher moisture vapor transmission rate to compensate for a lower absorption capacity, KerraFoam has been specifically designed with a lower MBTR to maintain an optimal moisture balance as identified in recent literature. The next three graphs show how KerraFoam will perform for protection from pressure ulcers. The three main tests are designed to measure 1. The reduction in relative humidity, which speaks to the microclimate under the dressing. 2. Pressure reduction. And 3. The reduction of shear and friction, which translates into opposing forces put on the patient's skin when they are sitting up in bed. As you can see in these three graphs, KerraFoam showed a reduction in all three tests compared to the other dressings tested. One of the benefits of KerraFoam Gentle Border is the way the release liner and the silicone were created. As you take the release liner off and turn it over, a lot of time the silicone dressing becomes floppy and sticks to itself, making it difficult to apply. We've specifically designed our silicone to keep it from flopping over on itself. In addition, even if the dressing does stick to itself, the silicone is very forgiving. While it stays on the skin very nicely, it allows you to easily remove the silicone when it sticks to itself. Now, in some dressings, if you were able to do that, it would then be hard to apply to the skin. In this case, as you'll see, it's very easy and gives you a nice, smooth application. The adhesive is also very easy to remove and reapply. KerraFoam Gentle Border comes in two sacral sizes, small and large. While both of them are applied in the same way, the large sacral size is made so you can apply it upright, and then also upside down, depending on where you need more protection or where you may have a wound. Now, when applying the dressing, you're going to start with the 3-step liner removal system. First, you remove the center liner, which allows you to fold the dressing in half. Once the dressing is folded in half, you will find the place on the sacrum where you need to apply it. You are then going to push down and smooth from the center out so that you get good adhesion. After the center is adhered, you remove the side liners. Peel the side liner off and smooth the silicone border from the inside out. Repeat the same steps for the other side, smoothing as you go. The great part about our silicone is, if it doesn't stick exactly like you want it, you can reposition it as you're applying it. KerraFoam Gentle Border also comes in a specific size designed for the heel. As you will see, the padding here is going to wrap around the ankle, and the padding here is going to wrap underneath the foot and onto the heel bone. Turn the dressing over and remove the center liner. You're first going to position the dressing underneath the heel. Press the dressing to the back of the heel and then to the bottom of the heel. You're then going to take the liner off one side of the dressing. Stick that side of the dressing to the ankle, and then repeat the same process on the other side. You now have padding on both bony prominences. You're then going to pull this up under the heel. Take the remaining liner off. Now this is going to come over and stick the dressing to itself, giving it nice adhesion. And repeat the same on the other side. This creates nice protection and also has absorption if there are any wounds.